Major story from the Fox medical team. Patients potentially put at risk because hospitals can't get the prescriptions they need. There's a shortage of drugs. It's all across the country, and it's leaving many waiting for help from surgeries all the way to cancer treatment. So how is that affecting people who rely on these medications? It's got to be scary. Fox 29 Shawnette Wilson live in Center City with the answer for you. Shawnette?
Yeah, Carrie, affecting people in a big way, and this is a problem all over the country. Philadelphia, no exception. A local doctor, though, says it is a short supply, not no supply, but patients tell a different story.
It was about 5 years ago. I found it.
Pam Cromwell was diagnosed with breast cancer at the young age of 29.
Chemo, radiation, double mastectomies.
And after all that, the cancer has now spread to her bones. Still, at 34 years old now, Pam says she feels better than ever.
When I didn't take medicine, I definitely felt a difference. I could barely get out of my bed.
Medicine, she says, is her only way of coping. Being forced to go without it scares her.
Absolutely. I mean, I don't know what I would do.
The healthcare industry is dealing with what some call a critical shortage of infusion drugs for people trying to beat cancer, infections, and other serious illnesses.
So it's something I've dealt with for many, many years.
Dr. Shema Cosme is an oncologist and pharmacist.
As you have more drugs, more need for more drugs, there's going to be shortages.
Cosme says crisis is an overstatement. But according to an Associated Press review of industry reports, there have been 15 deaths in the past 15 months, blamed on drug shortages.
There may be adequate substitutes with certain drugs that may be equivalent.
Substitute drugs have been a problem for many people, but Pam says she'd try anything because going without would be a major setback.
To think that that wouldn't be an option is an absolute nightmare, because if I don't have to go back to that chemo world, I would love to avoid it because I've got my life back.
And the FDA says that the main problem for the drug shortage is manufacturing plants being shut down because of contamination issues. Of course, if you have a concern about this, we're doing the story to inform you. We don't want to alarm people, so it's best to check with your doctor. Live in Center City, I'm Shawnette Wilson for Fox 29 News.